Hey guys, I hope you guys are doing well on today's Poop Tip Tuesday. We have a great show today. We'll discuss, can you safely take over-the-counter stomach medications like Prilosec long-term? Oh, this is probably the biggest question I get from my patients. I will talk about, are artificial sweeteners harmful for your gut, and what do I think as your poop guru about these particular foods? And we'll talk about which is easier for your stomach, aspirin or Tylenol. The great debate and your questions live on today's Poop Tip Tuesday. Guys, let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, let's go through some housekeeping. If you're joining me for the first time, my name is Dr. Islam, and yes, I am your poop guru. Every other Tuesday, I go live on my social media channels to answer your questions you guys may have. A couple of rules. Number one, if you have a question for me, put it in the comments down below, and I'll see if I can get to them. Number two, I cannot and will not answer personal medical questions. I may not legally be your doctor, but if you have a general question, I will answer them. And number three, do me a huge favor. Let me know if you're watching this live or on the replay. I'd love to see and hear where my audience is from. We have a great show tonight. I hope you guys are doing great. Hope you guys had a good Father's Day. Let me know in the comments down below what you guys did. I had the best Father's Day. I got home-cooked food, and I took a nap. That's all I can ask for, and that's all I wanted. So that literally made my Father's Day. That's all. I was really, really happy with that. I hope you guys had a great Father's Day as well. So let's go through the comments. Goldie's good seeing you. Thank you for watching on the live stream. Patsy's good seeing you as well. Let's see. Shelly, thank you for watching from New Brunswick. Zakir, good question. Amy, thank you for watching from, Kauai. Great. Shelly, thank you for watching from Canada. Sarah, thank you for watching as well. Patsy, good watching you. Shiraz, thanks for watching on the live stream. All right, so let's go through a couple of questions. And as always, at least once a month, I'm going to go through my reading list. Oh, so great. I know. Did you think that I'd go through a Poop Tip Tuesday without going through what I read? So we had a pretty strong week or month of reading for the month of, last month, the month of May. So I went through some of y'all's recommendations. So on my last live stream, one of you guys recommended a John Grisham book, Sparring Partners. I loved it. Oh, what a great book. A couple of short stories. I am really getting really into John Grisham. I pretty much have read now every single Lee Child book from Jack Reacher. I've read every single John Grisham book now. I'm getting to this. And I am starting to get into Michael Connelly. I got this recommendation from one of my patients as well. Started The Lincoln Lawyer. Actually, I started this yesterday. I'm really getting into these genre books, and I'm really enjoying it. I just finished as well David Balducci. Let me know if you guys have actually started this, or if you have any thoughts on this as well. Pretty good book. I'm starting to get into this as well. In terms of the nonfiction realm, I just finished this business book called Blue Ocean Strategy. It's actually a pretty interesting book. Because I have my own practice, my own business, I'm starting to really get into more business books as well. So really good book. They talked about competition and how in an area where there's a lot of competition, there's a lot of blood in the water, and it ends up being a red ocean. And what you want to do, you want to move away from that competition and maybe find a different path for whatever business you're in. So pretty good book. I got this book I just finished a couple weeks ago, The Almanac of Naval Ravikant. I have seen a lot of people on social media talk about this book. I thought it was okay. I mean, I kind of highlighted a couple different things here. You can kind of see these pages that are full. I thought it was all right. I don't know. I'm not too entranced with books that kind of talk about, I don't know, their own thoughts on things without a lot of evidence. This is basically his just spiel on a lot of different topics. Yeah, it's all right. Now, I am reading on the beginning of Tesla. Power Play. This actually is a pretty interesting book. I probably about halfway, maybe a little less than halfway done with this book, and you can already see I already have a lot of pages kind of underlined here. But basically, it's the beginning of Tesla. You know, Elon Musk's journey from PayPal, which I just finished last month, to his journey into Tesla. So it's you know, it's pretty amazing how Tesla just revolutionized the industry in developing the electric car, completely unforeseen and completely unknown, and basically just changed how we think of cars. So it's a pretty good book. Anyways, that's what I'm reading. Let me know in the comments down below what you're reading. Do you have a recommendation for me? Do you have any other books you want me to read? I really do appreciate that, because through you guys, I found some great books. So thanks for letting me know. All right, question number 1. Dr. Islam, can I safely take over-the-counter supplement medications like Prilosec long-term? So let me know in the comments down below. Do you take a medication like Prilosec long-term? I really am curious. Do you take it? Number 2, do you know why you take it? And then number 3, are you concerned about maybe you should not be taking it? And this is a very common question that I get, because I see a lot of things on social media about the long-term effects of these medications. So you see I put these on air quotes. So let's talk about this. So what exactly are medications like Prilosec? So we use these medications to help out with heartburn, indigestion, or upper GI issues. What they basically do is that they actually block the cells that produce acid. What we think is going on, in fact, what we know is going on for a lot of individuals is that when they have acid reflux, heartburn, upper abdominal pain, or indigestion, it ends up being an acid issue. Or it ends up being the acid being in locations where it should not be. And these medications actually stop those acid cells from being made, which in turn decreases the amount of acid being produced. Now, because of this, there are some concerns, and they have been some concerns, about whether patients should be on these long term. So here's the way I best explain to the patients. There are certain conditions in which I will tell you, yes, you definitively need to be on these acid medications. I am sorry, but you have a condition and you must be on it. And I'll tell patients, if you don't have these conditions, it is certainly worthwhile to speak to your healthcare provider about stopping these medications. What I do not want you to do is to stop a medication and you make a mistake of stopping it, because there are some conditions in which you should be on this. In fact, I have had to save patients who stop their medications like a Prilosec or Dexlan or Nexium, and they shouldn't have, and it almost killed them because they stopped it. Or they had another person who's not a medical doctor tell them to stop the medication. Completely wrong. It's completely unethical. And if someone tells you to stop the medication, they are not trained to tell you why or the reason behind it, they should not be the one doing that. So don't listen to them. So here are the conditions in which you must be on a medication like this. Number 1, you have a condition called Barrett's esophagus. So Barrett's esophagus is a precancerous lesion of the esophagus from chronic acid reflux. And this does lead to cancer of the esophagus. And the only way to decrease that risk and minimize that is to be on an acid medication. So unless you want cancer and you have Barrett's, you need to be on an acid medication. Number 2, you have an ulcer or you have a history of a really bad ulcer. If you have an ulcer, the only way to fix this is to be on an acid medication. That will help decrease the inflammation and allow the ulcer to heal. Number 3, if you are taking a blood thinner, a lot of people are on a blood thinner because of atrial fibrillation, clots, and whatnot. Guess what that blood thinner does? It thins the blood. And guess what makes it more likely for you to have an ulcer, a bleeding ulcer, or some sort of bleeding source. And being on an acid medication will help minimize or prevent that. Next, if you take a medication like a non-steroidal anti-inflammatory drug, Aleve, naproxen, Advil, Motrin, these things on a consistent basis, that also thins the blood, destroys the lining of your stomach. The only way to protect yourself is to be on an acid medication. If you have to be on long-term steroids like prednisone, that prednisone will also destroy the lining of your gut, destroy the lining of your stomach, make it more likely for you to develop an ulcer, and you need to be on a medication like Prilosec to help minimize that. And if you have GERD or reflux, you have pain, you have indigestion, you have upset stomach, it is certainly reasonable to be on these medications to help out with that. Now, if you don't have these conditions, it is also very reasonable to speak to your healthcare provider about whether we can get you off of these medications. Or if you have the occasional acid reflux, it is very reasonable for us to talk to your healthcare provider about whether we can get you off these medications. So let's talk about what are the side effects of acid therapy. Let me know in the comments down below if you have heard about these side effects and what you've heard, because I want to address them and specifically help you understand what you need to know. So things that I have seen out there, maybe there's a higher risk of cancer. Maybe there's a higher risk of causing bone damage, kidney disease, Alzheimer's, strokes, any number of infections, any number of illnesses, death. I've seen this everywhere, both in some of the research, in the social media, in people spouting out what they think they know about it. And here's what the science and the evidence says, because we have a lot of excellent studies now that have come out answering these questions. All right, what are the real side effects for this? Here's what you need to know. The biggest side effect that we know of, high risk of developing an infection, any infection, and some vitamin deficiencies. That is basically it. So we know that we don't have good evidence. There's a high risk for Alzheimer's, stroke, bone disease, kidney issues, death, cancers, none at all. And so don't let the hype of someone trying to scare you make you afraid to take these medications. Now, lastly, I'm of the opinion always that if we can get you off your medication, I want to do that for you. And if you don't need to be on these acid medications, let's get you off of them. Heck yeah, man, I'm going to do that for you. So here's what I recommend to all my reflux patients or have upper GI issues patients who do not have one of those conditions, in which I recommend you must be on it. Number one, you really need to fix your diet. Absolutely. If you're going to eat like crap, you're going to feel like crap, and your body's going to produce crap as well. You know what I'm talking about. Processed foods, fast foods, fatty foods. These things are not good for you, and they're going to make you have worsening acid reflux. Number two, lifestyle changes do help, meaning make sure you avoid late night meals. Don't sleep as soon as you eat. If you do sleep, lie on your left-hand side. That left-hand side actually helps to close that valve. You may want to consider sleeping elevated in the bed. Don't drink carbonated drinks, and like I mentioned before, don't have the foods that typically trigger acid reflux. Number three, the biggest thing that you can do by far is to lose weight. Weight gain and obesity is the biggest risk factor for acid reflux, and it is the biggest risk factor for the complications of acid reflux, including cancer of the esophagus. Now, one thing I have to tell all my patients is that here's the issue with reflux, is that you can do everything right. You can have the right diet. You can exercise. You can do all the lifestyle changes, and you can still have acid reflux. Point me. I have acid reflux. It sucks. I eat well. I exercise. I do lifestyle changes. I'm not overweight. I do everything right, and I still have acid reflux. So what do? I take a medication. Not a big deal. I'm not worried about those side effects. I've been dealing with this for a long time. I'm a specialist in this. And so I'm not worried about the side effects. And I would not be so worried about those side effects for you. However, if you do want to get off of it, you need to speak to your doctor to see if you are the right candidate to get off of that particular medication. This is my spiel on acid medications. I want to put this out to the world. Please share this, because I don't want people to be scared of a medication they shouldn't be, but I also want to give them good information, make sure they have information that is necessary and that's real and that's based on science. That's it. Off my soapbox. All right. Let me go to the comments really quick here, guys. All right. So Zakir asks, what is the difference between an anal fissure and piles? Very good question. So basically you're asking the difference between what is a fissure and what are hemorrhoids. Very good question. They get confused very often. So hemorrhoids are dilated veins in the bottom that typically can occur from pressure, straining. I'm getting hemorrhoids like that. Lifting up everything. So if you're a big heavy lifter or squatter, or if you're pregnant and you push, that can produce these dilated veins in the rectum. Now, people can have hemorrhoids and may not cause any issues. Not a big deal. But for some people, it can cause pain, bleeding, itching, and pressure. And there are a couple ways to treat hemorrhoids. We can use over-the-counter creams. We can use medical creams. We can do what I do, which is hemorrhoid banding in the office. And then lastly, there's surgery. That's just for hemorrhoids. An anal fissure is an actual tear in your bottom. This tear hurts like the dickens. It does not feel good. It feels like you're pooping shards of glass. It is severe, 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 severe pain, mainly because your bottom has so many nerve fibers that any little cut there is going to make it go crazy. Now, how you treat a fissure, you have to have softer stools. You have to make sure you have looser stools. You have to increase your fiber. There are creams that we can give to help out with that. Sometimes we can also fix the hemorrhoids, which can lead to a fissure. Sometimes we may have to give some medications or surgical therapy to fix that. But the treatment for a fissure can be a little bit different from the treatment of a hemorrhoid. But a hemorrhoid is a dilated vein, whereas a fissure is a tear in the bottom that it really is a little pain in the bottom. That's exactly what it is. Good question. All right, just going through some of the comments here. So Jiminy Critic, is it okay to jog or exercise when you have ulcerative colitis? The answer is heck yeah, man. We have seen studies to suggest that exercise can decrease your risk for developing flares of ulcerative colitis. So heck yeah, jog, exercise, do whatever you can to get you going, to get you moving. All right, next question. Are artificial sweeteners harmful to your digestive system? So let me know in the comments down below if you've wondered this or have you seen this, or what your thoughts are. So I actually like this question a lot because this gets behind one of my biggest things I try to stress to my patients is making sure you don't miss the forest for the trees. So here's kind of what we know. We have seen in studies that taking artificial sweeteners can change your gut microbiome to make it a little bit worse. We have seen this in animal studies and we've seen it in some human studies. We've seen pretty good evidence for that these artificial sweeteners do change the gut microbiome. That is the trees that I'm looking at right now. If you look at that, you can be like, oh my gosh, yes, it's terrible for you. Here's the forest, is that we don't know if that actually leads to any long-term issues. We don't. So we do know that in some animal studies, you do change your gut microbiome whenever you take artificial sweeteners for something worse. But does that lead to long-term consequences, long-term changes, long-term outcomes? We don't know the answer to that. Now, one thing I do have to say is that there are a lot of people who don't realize that artificial sweeteners could be a cause for your gut issues. Absolutely. Are you bloated? You may want to blame the artificial sweeteners. Do you have a lot of gas? You may want to blame artificial sweeteners. Do you have diarrhea? It actually may be due to artificial sweeteners. There is a huge segment of the population that just cannot metabolize these artificial sweeteners. It goes into their stomach, acts as a bomb that something blows up in their stomach to cause the symptoms of bloating and nausea and a lot of gas. So it may not be harmful to your digestive system. We're not quite sure yet, but it certainly can cause gut symptoms. In fact, one of the easiest things you can do if you have bloating, two things. Number one, eliminate dairy. And number two, eliminate artificial sweeteners. The vast majority of your bloating will go away and you will start to feel a lot better. All right. So Gina Caesar asks, how accurate is the poop in the box test instead of a colonoscopy? So very good question, and I've answered this before in a couple of videos. Here's what I'll tell you. Every single GI doctor in the whole entire United States is unanimous in telling you that the most accurate test to find precancerous polyps is a colonoscopy. There is no doubt every single GI doctor everywhere will tell you the exact same thing. We don't agree on a lot of things. This is something we do agree on. And so I am 100% pro colonoscopy. It finds polyps, it removes polyps at the exact same time, and we can fix the issue. Now, there are some individuals who may be like, hey man, I don't care. I don't care if this is going to save my life. There is no way I'm going to do a colonoscopy. Or there may be others who may be too sick for us to perform a colonoscopy. So you can certainly do the poop in the box. And this may be an accurate test, though not as accurate as a colonoscopy. Here's the issue with that is that you can have false positive tests and false negative from that poop in the box. False positive shows that the test comes back positive, but nothing's really there when we do a subsequent colonoscopy. And keep in mind, if you have a positive test, that means you need a colonoscopy anyways. But the other issue, the big issue I worry about is the false negative, where you have a negative test, but you end up finding something inside the colon later on, or colon cancer ends up growing later on as well. So in my opinion, and every single GI doctor can back me up on this, the colonoscopy by far is the most accurate test for colon cancer screening. All right, next question. Hey, Dr. Islam, what is easier for your stomach, Tylenol or aspirin? The great debate. People always ask me this all the time. So both Tylenol and aspirin are used for pain. You know, we can use it for different options of pain, and a lot of people ask me which one's worse. So here's what we need. Here's what we know about both medications. Aspirin actually is worse for your stomach. By far, it is. So out of the two for your stomach, aspirin is the one that we typically recommend to not take for your stomach. Why is that the case? Well, aspirin actually helps to degrade or kind of bring down the protective barrier of your stomach. Also, number two, it can cause irritation of your stomach as well directly by the aspirin effects. Now, if you add aspirin plus maybe taking a non-steroidal anti-inflammatory drug like Aleve, naproxen, Advil, or Motrin, you're almost tripling or quadrupling the damage in your stomach. And if you take an aspirin with like a steroid, the exact same thing. Aspirin plus a blood thinner, the exact same thing. This will just destroy and tear up your stomach. And for these individuals who have to be on aspirin, or maybe take an aspirin plus a blood thinner, a non-steroidal anti-inflammatory medication, or a steroid, they must be on an acid medication to help decrease the risk of developing an ulcer. What about Tylenol though? I'm sure you've heard some of the horror stories about Tylenol in the liver. Here's what we know. As long as you take the recommended dose of Tylenol, which is typically about 2 to 4 grams per day, which in most cases, it's about 8 Tylenols per day, if it's 500 milligrams, that typically is safe to do that without it causing any damage to your liver. There's no chance of damage in your stomach, and if you just take the recommended dose, it won't cause any damage for your liver. But by far, aspirin tends to cause a worse damage for your stomach than Tylenol. Great question. All right. So Cindy's good seeing you. Thank you for comment again. All right. Let me see. Lee, is good seeing you from the beginning. Let's see. So Amy asks, what kind of diet for diverticulitis? Oh, it's a great question. So here's what we know about diverticulitis. So diverticulitis is inflammation of the pockets of your colon. And what we do know is that diet does play a role. Yes, we're seeing more evidence for that. So a pro-inflammatory diet makes your diverticulitis worse. So what exactly is that? You know what I'm going to say. It's a diet that's high in meat, processed food, smoked food, and also smoking and non-steroidal anti-inflammatory medications. These increase your risk for developing diverticulitis and increase your risk for developing recurrent diverticulitis. So it means the opposite is true. A diet that's low in meat, high in vegetables, high in fiber, high in fruit decreases your risk. We're seeing evidence that this changes the microbiome of your colon to decrease the inflammatory guys, increase the good guys, and by doing that, you can kind of stave off that risk for developing diverticulitis. So the best diet for diverticulitis is more of a plant-based or plant-centric diet. It works, and we're seeing a lot of evidence. This is really helpful and really beneficial as well. All right. Tafa, thanks. Good seeing you. Thank you for watching from Mesa. Sorry, I'm just going through some of the questions here. So Andrew asked a good question about SIBO. It's a pretty good question, but basically you're asking, does SIBO ever really go away? So let's talk about this. So SIBO is a big thing. And if you join me, if you subscribe to my newsletter, I talked about SIBO a couple of weeks ago. And if you want me to go into more details about this, I'm more than happy to on a live stream. So SIBO is small intestinal bacterial overgrowth. This is when you have a predominance of a lot of bad bacteria in your gut microbiome in the small intestine that for some individuals can cause bloating, nausea, upset stomach, indigestion, diarrhea. Now, we have to try and figure out why you have SIBO, and it typically is going to be a chronic disease unless you resolve the underlying reason as to why. So some of the more common reasons why people can get SIBO, sometimes there could be if you've had a prior surgery in your stomach or your small intestine, that especially like a bypass or a Roux-en-Y, that can make it more likely for some of those areas that have been bypassed to develop stagnant bacteria. Number two is that if you have a slow motility, maybe you have a history of gastroparesis, diabetes, maybe even scleroderma or CREST, that can make it more likely for you to develop SIBO as well. Sometimes we have thought that maybe medications can sometimes increase your risk. We're seeing now a lot of great evidence for this. Maybe you have really bad motility in your whole entire GI tract. Maybe you have really bad IBS or constipation that can predispose you to developing SIBO as well. There could be some other underlying condition that you have that you may not be aware of it. So unless you remove or resolve the underlying condition, typically SIBO will come back. You have periods when you're better, periods when you're worse, periods when you're better, and periods when you're worse. And the only way for us to really know that is to see if we give you some treatment and just seeing how your clinical response is. For some individuals, we also may do what's called breath testing, where you breathe into a machine to see the bacteria spike that's there. Or sometimes we can actually get a fluid sample from your small intestine directly to see if you have this. But in most cases, SIBO will be chronic unless you actually fix the underlying condition. And if you do that, then hopefully it should go away. Good question. All right. All right. So Patsy has a very good question. When you have part of your intestine or gallbladder out, will you always have diarrhea? So Patsy, I'll just let you know, everyone's different. Obviously, some people may have diarrhea, some people may not. But when you do have your gallbladder taken out, it is a very common symptom or response to have diarrhea. What happens is that your gallbladder is an organ to store bile. So it kind of just holds bile that's there. When you have your gallbladder gone, guess what happens? Your bile goes everywhere. It can reflux up into your upper GI tract to cause nausea, vomiting, reflux, and heartburn. And it can go into your colon to cause diarrhea by irritating your colon. So yes, it can do that. So one way to treat both options is to bind up that bile, get rid of it, so it either does not cause upper GI issues or does not cause diarrhea. So in some individuals, it's very common to have your gallbladder removed and also to have diarrhea as a consequence from that. Great question. All right. Perfect. All right, guys. Well, I want to thank you guys. I think our time is up. I want to thank you guys for watching today. Don't forget to subscribe to my channel. Don't forget to tell me if you're watching this live or on the replay. Like, share, and subscribe. And if you want to stay tuned for more Poop Tip more Poop Tip Tuesdays, I think in 2 weeks should be going on. For more information, like my social media pages, subscribe to my newsletter, and I hope to see you guys soon. Thanks and take care, everyone. Have a great day.